probably, funnily enough, one of my favorite topics to talk about. It's where I started my life as a naturopath in really delving into allergies. And I was convinced that I was actually going to change the world as far as allergies was concerned. Well, it's turned out quite, a bit differently now, but it's still one of my favorite things to talk about, because everybody assumes that allergies are there for life and they never change. And I really want to be able to tell you that they do change, and you can change them, and you can, I believe, really make a significant difference with allergies, particularly kids. And in Australia, we have a huge population of kids with allergies, and I hope that I can really, set you on a path tonight that will give you a bit of an insight as to why we really don't need to have all these kids with allergies. And I think we can change it, and I think we can significantly reduce it. And I'll show you a patient case study of mine that will give you a little bit of an insight as to how we approach that. Let's go through some of the things that we're going to be talking about. Obviously, what are allergies? What are considered to be allergies? Signs and symptoms, because this whole histamine reaction, this mast cell activation, this allergy picture can present in many different ways for very many people. And when you go to a doctor and you say, I have allergies, what do they usually do? They either give you a nasal spray to dampen down inflammation, or they give you an antihistamine and say, this will help. And yes, it does help with the symptoms, but the problem is it's not addressing the cause. And that's the biggest issue that we have worldwide with allergies. We're treating the symptoms, but we're 100% not addressing the cause. Now, for many of you, any release of histamine is going to be an additional problem, because you may be genetically susceptible to not breaking histamine down. Now, it obviously affects us in many different ways. So for those people with asthma, well, it's affecting the lungs. With those people with hay fever, it's affecting the nose. The ones that have esophagitis and inflammation in the gut, obviously it's a gut issue. But you can have bacteria, for example, that are high histamine bacteria that are in the gut, like Morganella and Klebsiella. Morganella is one of the highest histamine producing bacteria there is. If that's in your gut, it's going to make you way more allergic. And then on top of all that, if the gut isn't doing its job and you have leaky gut, then that's when you get the food-based sensitivities. It can affect us in a variety of different ways. And at the root cause is this whole histamine response. So the histamine can make you nauseous, it can make you vomit, it can make you faint, it can make you it could give you shortness of breath. It can do redness, inflammation, and swelling in any tissue in the body. So whether that's the vagina, the gut, the uterus, that's what period pain essentially is, a histamine response. Whatever it happens to be, it is caused by a histamine response. And that hypersensitivity is why it's a histamine response, because the body is saying, there's something wrong here. I'm going to do everything I can to deal with it. Eczema, rashes, all of these things, hives, are all an indication that the histamine levels are too high. So we have to find out why. So what they do is the tests that you literally prick a certain thing against your skin, and they look at the reaction. Is it hives or is it an increased response? and say, well, that's the food that you can't eat at this point. Because the problem is, if you've got a leaky gut, you are going to react negatively on a food sensitivity test to anything that you are eating on a regular basis. So one really important aspect, I believe, is that and I didn't discover this until relatively recently, but we have one of the highest folic acid fortification doses of any country in the world. The US has 100 micrograms per 100 grams. We have 200. So we have double the US. Now, as you all know, that by now, hopefully, that folic acid, if it gets to levels where there's unmetabolized folic acid building up, it causes a pseudo MTHFR deficiency. So your ability to have active folate, 5-methyl tetrahydrofolate, becomes compromised. If that is compromised, guess what you don't make? SAMe. If you don't make SAMe, which is the cofactor for you to break down histamine, histamine N-methyltransferase, if you don't have enough SAMe to do that, you are going to be more allergic, whether you have polymorphisms or not. So I guess the takeout for you would be this. If you have genetic susceptibility, and many of you with allergic profiles may have genetics in HNMT, the histamine N-methyltransferase, because we have certain pathways that really help us break histamine down. One of the very first cases that I had when I sort of started in the whole world of MTHFR. So I'm going back about 12 years ago, but it still sticks in my mind today. So this little boy came to the clinic. It's not him, by the way. That is a different photo. So his mum came in and she said she's just been to an allergist and a specialist. And she said, my son has severe anaphylaxis and he was told that he was allergic to 62 foods. Now, can you imagine being told that your son is allergic to 62 foods? She spent most of the appointment crying because she said he was losing so much weight, she actually didn't know what to feed him. She was scared to feed him. So if you have a high histamine response, you are naturally reactive to weather temperatures. So if it gets hot to cold, you go out, let's say it's cold, you go out and you do some exercise and your nose is streaming. I would call that a histamine-based response.